Hello everyone, welcome to my channel Ravi Static Features. In the series of pharmacology, the next topic is peptic ulcer disease, which is very essential for university examinations, so how you can write that. So let's understand about what is peptic ulcer. So a condition that causes ulcer or open sore to develop in the lining of your digestive tract, which is intestine or large intestine, or also the stomach, where we have to be shown that ulcer and open sore. Basically, it will be occurring in the duodenal and stomach region. The word peptic comes from the pepsin, a digestive enzyme that your stomach produce. So pepsin enzyme is to be produced over the time the digestion to like break down the food and absorb the nutrients. So the bacteria's name of the present, which is pepsin, are Helicobacter pylori, which is H. pylori bacteria present in our mucous layer of stomach, which is and duodenum, weakening the protective lining and allow acid to damage the tissue. So if any kind of weakness in your stomach region and too much acid production, too much any kind of interruption into your lining of the villi of your stomach, so that will be caused the damage of the tissue over the duodenal region. So NSAIDs. So NSAIDs is a regular or long-term use of pain relief such as aspirin, ibuprofen, and macropsin sodium can inhibit the production of prostaglandins such as necessary production of stomach lining. So NSAID reduce the symptoms if you are taking this medication, which is ibuprofen or aspirin, but make sure what kind of condition on the taken by the medicine. So if there is a type of peptic ulcer disease, first is duodenal ulcer. So if ulcer is present in duodenum into the stomach, account to the almost 80% of peptic ulcer is to occur over there. Next, second is to be stomach ulcer. Is a 20% of peptic ulcer is present into the stomach ulcer, but 80% is to the duodenal ulcer. So what kind of symptoms arise in your body? So symptom is to be bloating, internal, burping, heartburn, loss of appetite, nausea and vomiting, pain and wake your night. So if there is a sore in your stomach lining, so there is a too much pain and you can't sleep in your night, there is a pain arising in your body. So the complication is to be shown in your body is to be gastrointestinal bleeding, which is ongoing blood loss from the ulcer. So ulcer or open sore continuously releasing the blood into the inner stomach lining, and your gastrointestinal perfection, an ulcer that makes a hole in a GI tract. So continuously repetitive, if you're not treated the GI infection or peptic ulcer infection, so that will be cause a hole in your GI tract. So the diagnosis to be imaging test like CT scan or GI X-ray. So these are the types. So up now, how the drugs you have taken, what kind of drugs you have taken for the pharmacological treatment for the different condition. So medication is to be antibiotics, H2 blockers, omeprazole, lisinoprolol, and famotidine. These drugs are stop the ulcer too much occurring to your other nearby the cell, and also control the prostaglandin symptom. You have to take in NSAIDs, which is aspirin or ibuprofen. Apart from the together you have to take an antibiotics, which is reduce the function of infection or sore into your stomach. So what kind of effect you have to install if you're taking the medication? So it will be reduce the stomach acid production by inhibiting the proton pump and ATPase enzyme system in the stomach lining promoting. So if you're taking the medication which is antibiotics, so it will be reduce the production of stomach acid and the proton pump that will be help to stomach lining for promoting the prevention of the rapid healing of the ulcer, which is omeprazole, which is reduce the acid production and also help to healing into the ulcer. Famotidine, these and nitrazine, these two drugs help to reduce the amount of acid and stomach production into the stomach. So these two drugs reduce the amount of production of acid, and omeprazole reduce the healing, increase the healing of the ulcer. So if you are taking too much drugs continuously, the side effects will be occur. So what kind of side effects is to be headache, dizziness, diarrhea, nausea, and magnesium deficiency and vitamin B12 deficiency will occur in your body. So that is the peptic ulcer disease. You can write university examination for good marks. Thank you.